We are fortunate to have with us today Steve Liga. For the past 12 years, he has been the Executive Director of the National Council for Alcohol and Drug Dependence for Middlesex County. Now celebrating its 30th anniversary, the NCADD of Middlesex County is a nonprofit organization whose mission is to promote the health and well-being of individuals and communities in Middlesex County through reduction and elimination of alcohol, tobacco, and other drug use problems by offering prevention and education programs, intervention, recovery, and advocacy services. Thanks for coming today, Steve.
Happy to be here, Ian. Thank you.
So, can you tell us about the NCADD programs that focus on teens?
There's actually 3 different ways that we can help teens in Middlesex County. The first would be if young people have friends, or if they themselves or even a family member may be having a problem with alcohol and drugs, they can give us a call and we can help them make good decisions, help them to get help for the people they care about.
What about, you mentioned 3 programs.
Yes, we have a number of ways that young people can get involved in substance abuse prevention and advocacy in their own communities. We have a Healthy Communities Coalition with a youth task force. We already have several young people on the task force, and we're always looking for more. There's many ways that young people can get involved. We even have a Acts of Prevention acting troupe that we started this past year.
That's pretty cool.
It's very cool. Thank you.
And the last?
Well, the last is more the traditional education, presentations, and curriculum. So if you belong to, say, a faith-based youth group and you would like to have a presentation done, you can call us. We'd be happy to come out and talk to you and your group. And even if, say, there's a local community organization that would like to sponsor a curriculum in your school, they could contact us and we could come and really bring in a nice addition to your school health program.
That's devotion right there.
Yeah, we love what we do.
Do you have any online resources that teens can reference if they need help or if they're interested?
Absolutely. They can come to our website, for one, which is very helpful. We've got links to many other sites. We've got information that people can download. If people need help, they can get help right through our website. But I understand that we're going to be listing a number of very youth-focused websites during the credits.
So, you know, I learned in school that marijuana is the gateway drug, and usually teens use marijuana to experience drugs. But now prescription drugs are going up with teens overdosing. Is prescription drugs a new gateway drug?
Well, if you look at gateway as the first drug that somebody would choose to experiment with, other than alcohol and tobacco, prescription drugs are now tried first more often than marijuana. For 30 years, marijuana was the first illicit drug that a young person would try. For the past 3 years, more people have started using drugs by trying a pill rather than smoking pot.
That's insane. That's
Yes.
not very good.
And it's very dangerous.
So you're saying that's pretty much worse to overdose on prescription drugs?
Well,
or it could be.
It absolutely could be. Marijuana has a number of negative consequences, but thankfully one of them is not death. You can't smoke enough to kill yourself. It's very easy to overdose on prescription medications.
And then end up dead.
Exactly.
So can you tell us a little bit about Jason Sirks?
Yeah. I knew Jason from when he was 12 years old. His mom actually works with me at the council. And he was in the office all the time helping put labels on brochures for us and just helping out. He was a really good kid. And when he went to college, he went for pharmacy, as a matter of fact, pre-pharmacy major. And he thought that he would be safe. He knew enough not to try cocaine, not to smoke pot, not to use heroin. But he was a pharmacy major, and he knew, or he thought he knew, a lot about prescription meds. And this was right when they were becoming increasingly drugs. Unfortunately, one night he lost track of how many pills he had. And he didn't wake up the next morning. He was 19 years old.
How long ago was this?
Oh, I think it's been 4 or 5 years now.
So yeah. This is when prescription drugs were getting like big and more dangerous for teens.
At least they were getting much more accessible, and they seemed to be becoming much more attractive. And now we see people using prescription meds as young as 13 years old.
So what was your motivation to join the NCADD?
Well, I always knew I wanted to help people in some way. I didn't exactly know what it would be. Initially, I thought I would work with people who had housing and homelessness issues. And I got a job at a program that worked on homelessness, but they also had a substance abuse program. And before I knew it, I was shifted over into the substance abuse program, and I found out I loved it. I had a real connection with people who were trying to find recovery. I loved the work, and the more I learned, and the more I worked with people, the more I reflected, I realized it wasn't an accident I was there, because there were a number of people in my own family who had those issues that I hadn't recognized. Yeah. Most of us have somebody in our family that's suffering in one way or another.
And you learned this through joining this association?
While I was working as a counselor in a treatment program. The more I learned from what clients told me, I recognized, wow, somebody in my family looks and acts just like you did. Maybe they have a problem too.
Well, now you could say you could help.
Yeah, I have been.
Official help.
Yeah.
Well, thank you for answering my question. I'm going to open the floor to some questions that they might have for you.
Sure.
So you said the prescription drugs are really dangerous to use. Is it okay to hide them in your house? Is it important to hide them?
Actually, when we talk to parents, we tell them that they should hide them. Typically, they're kept in the family medicine cabinet in the bathroom, which means anybody who uses your bathroom opens the cabinet, and they can just look down and see what you have and what they might want to try. A lot of parents are good about locking up or keeping their alcohol so that it's not accessible. Now we really think they need to do the same with their medications.
Is there hope for teens who go to treatment?
Absolutely. In fact, there's great hope for teens who go to treatment, because their addiction hasn't gotten as bad. We know that when people start having problems with alcohol or drugs, the earlier we intervene, the better. It's much better to treat somebody who's 17 than 57.
Anyone can go online and order prescription drugs. Shouldn't there be laws against it?
Actually, there are laws against it, but they're almost impossible to enforce. What happens is many websites are based overseas where it's not against the law to sell prescription drugs without a prescription. The United States actually has laws that say you cannot have a prescription medication unless it's prescribed by a doctor that you have a relationship with. Now, that's not the same law all over the world. So other websites, it's legal for them to sell to people. It's illegal for us in this country to buy them and to have them, but it's not illegal for the person overseas to sell them, which makes
Someone that's not willing to get help.
That's a tough question, and we get it all the time. One of the little sayings that I heard a long time ago that makes a lot of sense to me. You know, you can't lead a horse to water and make him drink, but you can make him thirsty. And the idea is people who care about someone who has a problem with substance abuse can be there for them. They can talk to them. They can try and educate them.
Sorry to say that's all the time we have for today. Many thanks to Steve Liga for coming and telling us all about the programs offered by the NCADD of Middlesex County. This ad was created in memory of Jason, who died at the age of 19 from prescription drug abuse. He had many friends who just didn't know how to help. Please remember, if you are worried about a friend who drinks or does drugs, don't walk away. Find out how to help. You can make a difference by contacting the NCADD or going to the website after the program.